All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, with me today, we have Michelle Zimmerman. She is a PhD in learning sciences and human development. And yes, she has run into the walls a few times. This happened sadly because of the neuropathic injuries because of the vaccine. So let's welcome Michelle and listen to her journey. What we'll do is this: we would listen to the symptoms she developed, then the all the tests that she has done to try to figure out what's going on, and what were the treatments that worked and those that did not work. So, Michelle, welcome.
Thank you. I appreciate you
So,
having me.
yeah. So, as much as there is levity that we said you were running in the walls, tell us a little bit about yourself, what happened, and if you like, I can bring up the. Um, Before I bring up the PowerPoint, please tell us about yourself.
I was just going to pull these out first just to show that this is something that I've not worn before. There are no lenses in here and they're just occlusion. So if you're wondering, that's one of the most common things I've had people ask recently, what's going on with your glasses? So as Dr. Bean mentioned, I have a PhD in learning sciences and human development from University of Washington. And my goal was to go back into the classroom to work with kids to help prepare them for future of things that are unknowns. And I was on the front lines of doing COVID pandemic response. I started reading research medical journal articles in February 2020 and have not stopped since. And that actually served me well, having background in neuroscience and some of the pharmacology areas, to be able to talk with some of the frontline doctors, nurses, epidemiologists in making the plan for our school.
Got it. So once again, welcome. Thank you very much. Um, mm, Sorry for your injury, and sorry that you have been going through this for such a long time. And hopefully, your discussion here can help others figure out that number one, this can happen, and number two, what kind of diagnostics may be possible, and number three, what may be the therapeutics to consider. So, for the audience, this is not a medical advice. This is an informational discussion with a patient of vaccine injury. So, here we are.
I wanted to pull this image up first because it was one of the last things that I found out to understand about my series of symptoms. And as the mentioned with the binasal occlusion, so on either side of the nose, binasal, and it includes vision. So if I turn my head to the side, it blocks out some of that image. And I found out about it that it's been more recently researched with military populations who have come back after concussions and traumatic brain injuries. And they're a group of people who knew they needed to figure out how to diagnose something that hadn't been diagnosed. So from around 2009 through 2017, there's been an increase in some studies in that area. So let's go to the next one. I got really fascinated once I figured this part out. Thank you to first my vestibular therapist, who realized something was wrong with my vision, and then had me go to a speech therapist, and who found out visual scanning. And I've been really following Dr. Bean's work, including some of the work on all the work on long COVID actually, and seeing how many similarities in the types of symptoms and physiological responses that long COVID patients were having to what I was having, to be able to look at and remember structure and function of the eye and how that connects with brain.
Got it.
So this is very recent, and it took over a year to get brain imaging that actually clearly and visibly showed that there's something wrong. SPECT scans look at blood flow, and it uses radioactive tracer in your blood and then takes images from there. All the circled areas are areas that are atypical, abnormal, that are not getting blood flow. And this is the baseline image for when I'm completely at rest. The prefrontal cortex works with working memory, focus and concentration, mental endurance, the temporal lobes with speech and language. I can sound normal right now and for probably about a half an hour to an hour. But then I can lose verbal speech. It'll sound sometimes like I'm stuttering. It helps that I'm sitting down right now. But if I try and walk and move my head and move and talk and answer questions, something drops and falls, like you're trying to juggle and you can't keep everything straight. So that's one reason I have so many slides, because working memory and speech is still really hard with vision.
And Michelle, thank you very much for being with us with this injury, with this disability, and still helping us educate others and see how your journey was. So this is another image.
This is the concentration task. So the first one that you saw was baseline, when I'm not thinking through, or not, your brain's always working to some extent, but not fully concentrating. And with concentration tasks, they're able to see inflammation, cerebral cortex, and be able to see decreased activity in multiple different areas that are definitely abnormal. Interestingly, they're all the areas that I mentioned to the first neurologist that I saw after I was starting to see her and able to even stand up and speak again. I have background in neuroscience all the way through doctoral level, and it's a strange feeling to know about certain areas, but then to actually experience it physically and think, there's something wrong with this area of my brain. There's something wrong with this part of the processing, or the ability to speak or see, or those types of areas. And I asked, is there a way to find out? And MRI showed, she said unremarkable, and said there was nothing wrong, but the MRI didn't come until a month after the worst symptoms. So even a full year out, we're able to see blood flow in a different way that shows there was evidence of injury.
Got it. And Michelle, please don't be offended. There is, once again, there's a question about your glasses. So I think this is going to happen as people join in the middle of the talk. So just once more, this is Fried Chicken. What's wrong with her glasses? Sorry for asking. So what are these glasses for?
We'll talk about this even, there are a few slides later on, but it's called binasal occlusion. And there's no lens in here because my brain can't actually handle any light bent through lenses right now. I still have 20/20 vision, but there's been damage between the signals from my brain to my eyes. The structure of my eyes are fine, but it is helping reset the way that my eyes and brain process information. You'll notice that there's only one on the left side. It's because there's something that's called a visual midline shift. So when I had my left-sided weakness, I couldn't respond, speak, talk. They said it was stroke-like, but never diagnosed it as stroke. They said I presented like a traumatic brain injury where I had unilateral problem. I had vestibular hypofunction in left side as well. And for over a year, we didn't know why I was tipping constantly to the right. And it's what I found since in research also is that the side that is not getting the function correctly from your brain tries to compensate and shift the rest of the world over to the side that is working. And so what I perceived in one direction or one area was not where something was. So if I tried to reach for it, I reached in the wrong location. And that is one of the pieces of why I was running into walls and we couldn't figure out why. People said it looked like you're drunk, but I don't drink alcohol and hadn't. Don't drink caffeine, don't smoke anything, don't use any drugs, and no other medication. So there's no explanation that people could understand now that we know vision is. That's part of what's going on. I'll tilt my head a little bit so you can see where it blocks some of the vision in different angles. And then they're added two other occlusion pieces here.
So thank you very much for this, and so sorry that you're going through this.
This actually goes to the next piece right there. As soon as I found Dr. Kapp and Katie Chapman, who are working with me on my vision, Dr. Kapp recognized it immediately. She ran through a couple different tests and she knew what was going on. And from there, I was so fascinated that these two pieces of occlusion on the side of my nose made such a difference, because even walking into a store, this is the first time I found an image that looked similar to what it felt like. Constant nausea is a feeling of my eyes couldn't stay straight on scanning across rows. I remembered back in 2009 to 2012 when I was communicating with people who were deployed and coming back from overseas military, they would describe how horrible it was going into grocery stores. And I thought that maybe it was just such a different culture shock. But now that I'm experiencing it, I'm also wondering if they were going through some type of concussive symptom, some TBI that had changed some of the ocular responses. Sitting in a moving car trying to stand up straight, the dizziness, escalators, any of those kind of spatial reasonings, so much feeling like I was going to vomit. And people said, well, maybe you're just motion sick. And I'd never been motion sick in my life. Someone tried a scopolamine patch that they use for people who are motion sick on boats, and that made me worse. So it was interesting that it helped rule out that it was not a neurotransmitter problem, that was standard motion sickness.
Very interesting. Very interesting. So, just a quick addition here. My niece actually has very similar symptoms, although I believe she has recovered a lot. But she used to say this, that when I go to a grocery store, it looks like everything is fast. And I think this next image is also something that she used to experience as well. And that is, she used to say, I cannot go to the mall. Everything looks fast, everything looks confusing. So you have these images here as well. What do they tell us?
Once I started realizing that this was actually vision, and that was the first step in vision therapy to help me identify what was going on, this actually was real, I started looking online to see if I could find any pictures that could help me describe. These symptoms are some of the hardest for people that I've heard with long COVID and post-vaccine, people who've gone through car crashes, things that are like concussions from sports injuries, all those types of things can happen. And I tried to describe it that around December when I was looking at Christmas lights, and I said, it looks like I'm looking through a fogged window with the lights behind it, but it's kind of moving and shaking at the same time. And I found several websites that showed different ocular problems. I sent them to my vision therapist and optometrist and said, this is the closest I've got to describe it. The one that's on the left center or bottom where it has white lights, and then there looks like a rainbow spectrum. If I move my head or my eyes move quickly, it looks like white light splits apart and there's a band of rainbows. It's pretty, but it's very uncomfortable because it's not normal, and I know it's not supposed to happen. The one above is similar to what someone would experience in an ocular migraine, for people who haven't experienced that, where it kind of blanks out some of the vision of what you have in your visual field. So when I started talking to more people like me who were vaccinated, and people said, oh, that can't cause anything, you're going crazy, it must be anxiety. The more I asked them about different symptoms, especially the visual ones, I'm seeing a lot of similarity. Things like light flickering through the trees, trying to be a passenger in a car, light glinting off of water. Any of those types of things create a difference between the perception that you have in your brain, especially if both eyes aren't working. They're not playing nice together.
Got it.
And so this was the first that I actually got a diagnosis that showed there was deficiencies in the saccade, so the way that your eyes move back and forth. That computerized testing showed significantly reduced visual skills to be able to efficiently read and work on computers. I had been describing for over a year that it was excruciatingly painful trying to read, and it felt like my eyes were bouncing. I couldn't move them smoothly across words. And it was the first time someone put in writing that I presented very similar to a TBI patient, with light sensitivity, tracking visual motion hypersensitivity, and then speech and memory are really fascinating with this, because I saw a speech therapist, a first one, and she said, well, I don't know what to do. Vaccines don't cause speech problems. And it took my vestibular therapist saying, you're presenting like someone who is older or they're going through dementia and they have to stop before they say something. And she said, it seems to me that your brain is trying to process so many things that are not working correctly or going to different pathways, that there might be something going on with your speech there. And she worked really hard to find a speech therapist who would work with me. And Dr. Sarah Mattingly, vestibular, I've been describing her as like the Sherlock Holmes of this entire time with me, because she's looking at function and structure, and then the combination of symptoms in whole body, and not just, well, I'm a cardiologist or I'm a neuroscientist or I'm a hematologist and I only look at that one area. So because of that, we were able to figure out that the speech was not standard stuttering or losing verbal speech, but that it was tied to vision, vestibular, and working memory.
Got it. And for the audience, TBI is traumatic brain injury. And so here, uh, would you be okay disclosing what vaccine had you gotten and when?
Yes, I received a single dose of Johnson & Johnson on March 14th, 2021 at a mass vaccination site.
Got it.
I was never able to be diagnosed with the TBI because I never had impact to my head. And so I understand that diagnostic criteria requires some kind of impact for it to be a TBI. I couldn't be diagnosed with a concussion because, again, I never hit my head. But I was thankful to the new PCP, primary care physician that I had, who, despite a normal appearing MRI, no tumors, no major blood clots that were visible a month after my worst symptoms, he said, "You still look like a concussion patient," and he was willing to identify encephalopathy. This series of pictures were a reminder to me of how to describe some of the symptoms. The image of the sculpture is from when I was visiting Australia to interview and work with someone who is in AI in University of New South Wales and visit an art museum. I took the picture then thinking, I wonder what the artist's story was. What were they portraying? What were they thinking about? And I posted it on Facebook and it came up in memories. And I looked at it again after this injury and I thought, my goodness, this is exactly what I've been feeling like since my vaccination, even down to the point of one arm hanging down by the side. My injection arm went completely numb. Within the first 5 minutes of injection, my wrist dropped and I couldn't move or grip my wrist. I had shooting pain that went up through my arm to my ear. And I asked at the site, is this normal? And I showed what happened to my wrist. And they're kind of like, no, we don't know. And then they sent the nurse over and they said, did the pain start immediately when the needle went in? I said, I hardly felt the needle. It was about 5 minutes afterwards. And then it just shot pain all through my arm and up through my ear. And then within the first 10 to 15 minutes, my tongue and throat started feeling really thick. Felt like my tongue got fat and I could feel it in the back of my throat. I shouldn't laugh, but it's either laugh or cry. So I kind of feel like I try and lighten that up a little bit, but it's very serious. And within that evening, I had 104.8 fever. I went unresponsive. My heart rate went really high. My parents tried to call, and they actually drove me home from the vaccination site. They tried to call people to find out what might be going wrong. And they said, oh, she's probably just sleepy. Let her sleep it off. And I was never one who took naps during the day. That concerned my parents, that alone. But when you look back at the image, the sculpture, the other things that were similar, when I came out of being unresponsive, where I couldn't move, I couldn't speak. There was one time my mom put her arm on my shoulder and asked if I was okay, and I could hear her. But as hard as I tried to speak, I couldn't move my mouth. I couldn't even shift to try and acknowledge I was there. I couldn't move my arms or open my eyes. And all I remember is her feeling her hand again and not wanting her to leave. And it made me realize, coming out of that, that if anyone ever tells me again, someone's in a hospital or something happens and they say they can't hear you, don't even talk, that I decided I will talk to someone anyway, because the amount of terror it felt not being able to move, speak, open my eyes, and not want someone to leave my side was excruciating alone, not even to mention the pain. But going back to that image, when I came out of that within the next several days, light sensitivity was excruciating. Any sound that was even the slightest brush of something across a table was extremely painful. So this idea of the head being hung down and ears looking like you're kind of like trying to get the sound away from your ear, but can't even lift your arm to cover your ear. The feeling of your whole torso being collapsed. I was in such severe abdominal pain, kidney height pain. It went all the way across my back. Went between feeling like I was hitting the bat with an arm and then going numb, and then back to feeling like it was hit all over my arm. And then over the next weeks and months, not even having enough strength to stand up in the shower or take a shower by myself or even dry off. So looking at this image, just staring at it, it feels so much like what I've experienced in the last year. And I realize what art can do to help describe and put into words something that you don't have words for. The 3 books by the side were meaningful to me also because I worked towards helping kids understand a future with AI and not knowing what would happen with ambiguities or chaos before the pandemic even. And deep medicine intrigued me because I wanted to know how applications to AI were being used in medicine now that I'm experiencing this, because I was so healthy before, I'd hardly gone to the doctor. I'd gone to a couple checkups, but I hadn't even had a PCP reestablished since he retired because I was healthy. But now going through this audiobook, because I couldn't read, I not only recognized all the tests, but I'd gone through them myself. And there was a really tight connection between balancing humanity and technology, in that we need to be constantly curious and ask questions for things that we don't understand. And that's something that I think is really important in this discussion, because I got the vaccine to support the healthcare system, to show how much I valued science and research. As a researcher, I knew that ethical protocols need to be in place, that there need to be safeguards, and I trusted all of that. I wanted to model that it was safe and effective. I wanted to be a demonstration for my school families and the local and global community that I've represented in education and science and technology. And I found myself in this position of not wanting to speak until I felt like I could say something very clear about what was going wrong. And little did I know how little people knew. And so with those books, I appreciated doctors who looked at situations that they thought, like every deep drawn breath, ICU doctor, the idea that you want to save someone's life. And when you accomplish that, there's this victory of this person is alive. This is amazing. And then when you see, sometimes there's some aftermath of ER stays, and you see how someone's life is altered to the point that they can't function anymore. And it becomes this really difficult question to grapple with of, you can save a life, and then you can also have aftermath, even in ICU care. And we're seeing the same thing is possible in vaccination, that you're saving lives. But there are some people that are being called collateral damage right now for doing the right thing. And we don't want people to get to the point of saying, you can't talk about what's happened to you, because that might make someone feel uncomfortable. Good science asks questions. They don't disregard questions. They find answers to get things better the next round.
Agreed. And Michelle, I was speaking with someone about you today, that I'm going to interview you. And I was saying that I met a very brave girl. So, what is going on with you, the injury, the life, the disability, and you still sit here with this courage and discuss it, and laugh and smile and educate us. This is admirable. And so here V121 says, thank you, Michelle, for having the courage to speak up about this. I saw one more comment a few seconds ago, if I can find it. Comments just roll up fast enough, where someone was saying that you are so brave. Here, Blues Lover says, she's so courageous. Thank you for sharing. So thank you really for being here, for discussing it, and sad that you're going through this. So
These,
what are these images?
I wanted to put these, and I hesitated at first because you're like, why does this have anything to do with a vaccine? As a teacher, that's what I'll do with my students, and unexpected, and what does this have to do with anything? Well, sometimes when people are having a severe adverse reaction to a biologic of some sort, people say, oh, well, they must have been really not healthy to start with, or they didn't have a good immune system, or they weren't physically active. This was me before the vaccine. I was a dancer. I taught dance. I was able to balance. The one on the bottom corner is Dancing with the Stars at Sea, where it was literally in the middle of the water, where the water was rocking on the boat with lights, with movement, in heels, and I could still balance. I look at that now and I'm completely amazed that the human body is capable of even doing that, because I have difficulty with daylight that's cloudy on a rainy day, and standing straight, and being able to even talk at the same time. The top one is when I was a passenger in the Evergreen Speedway, where I was teaching a lesson on cars and physics to students, and wanting to capture the movement in the car, what it looked like when you're torque and tripoding, and when you're different physics concepts. And now to consider that I am having difficulty even as a passenger in a car with motion just going by at 20 miles an hour. What changes this overnight when there's no underlying health condition over 15 months, when there's no test that says we can find something that caused this? And the only difference was minutes between a needle going into my arm and what's occurring now. To go from climbing and hiking and doing indoor skydiving and field trips with my students to having an evaluation that my fall risk was high, that was shocking to me. And to realize that even when they had me close my eyes, I couldn't stand with my eyes closed without tipping over and feeling like the whole room was spinning. I put that one example of the salsa dancing because I was someone who twirled so often with that people would say, oh, let's see how many we can do. And some would count out loud up to 12. And the closest explanation I had for the severity of the dizziness was a night that I pulled an all-nighter doing research, went salsa dancing the next night, didn't stop for 3 straight hours, and someone spun me 12 times, counted out loud, and I needed to get back on rhythm. I was able to do it, but the amount of effort that it took to do that, and then the sense of the room spinning, felt like that constantly, just trying to even get up out of my bed to walk to my bathroom. And that was not normal. To go from being a public speaker, a book author, working on cutting edge technology with teaching artificial intelligence, to not being able to remember the word Rome when they asked me the capital of Italy when I've taught that, and to see that my cognitive scores went down to the 21st and 23rd percentile, that some areas were still unharmed, 96th percentile, they said you're fine there, but numbers and anything visual scanning, angles, lines, all of those patterns, I couldn't even handle. And by the time I even made it through this test, I almost fell out of the chair trying to stand up and ran into the wall then. And they go, we don't know, vaccines can't cause something like this. But at least they were able to document, because prior to that, my neurologist said, there's nothing wrong with you. And I said, I can't even get word recall. I can't finish a sentence from short amounts of times I can talk, but then it goes into stuttering and it's like all the words are lost. And she's like, oh no, a vaccine can't do that. So I liked this idea of, this was in the Deep Medicine book, WNL, within normal limits. Or I liked the line, we never looked. As a teacher, we know that we can give kids tests, and sometimes they give us some information, but if we don't do the right test, we can entirely miss that someone has dyslexia or dysgraphia and think that they're just bad at math or reading. Sometimes that's happening in medical testing, that the most standard tests that we use, and we're used to being able to find something remarkable, turns out to not be the same mechanism of what's going on in long COVID. In COVID, when people are saying these bizarre series of symptoms, from COVID toes to different types of neural conditions. Why is this happening if it's a respiratory disease? But when we start looking at what are the symptoms and what are we testing the things that are giving us the answers? I hope that people start questioning, rather than saying there's nothing remarkable on these tests, to say, what tests do we need to look for to see if something's wrong?
Agreed.
And I bring this up because this was shocking to me. Not totally shocking, but as I described how painfully difficult it's been to read since I came out of the being unconscious, unresponsive. It's a 10th grade level text for one of the vision tests, a computerized one. It follows your pupils and watches where your eyes go. And my result came out the equivalent of a 2nd grader. You can see the bouncing across the words, where my eyes are trying to move, even to just struggle to get from word to word and read them. And you can see where it regresses back because I couldn't remember what I had just read. And then the next thing was trying to see if you can recall what you read. And from going from medical research journals and neuroscience to not being able to read a basic 10th grade level text, that was eye-opening.
So these dots here are where your eyes fixate.
Yes.
And then the red ones are your saccades, your movement from one word to the next or one place to the next. And regressions are where these green ones bring you back. And the return sweeps are from the right side to the left. And you are all over the place, unfortunately, over here. And so they said your level is 2.
Yes. It made me aware of some of these tests that I didn't know existed, that I intend to bring back to education once I can get back to working, because I'm still not cleared to work. But I realized that there are children in the class that may have had some of these same vision difficulties, but never got diagnosed as that because their acuity was fine. As a teacher, I want to bring humor in because it's either you laugh or you cry, and you have to have a balance of both. And so that phrase of it's not rocket surgery, it's how I'm kind of talking now, where you mix two different things together. It's not rocket science, it's not surgery. But the idea seems so basic when you say, find out what the symptoms are and then look for those, rather than just saying it's unremarkable and you're fine, there's nothing wrong with you.
Got it. So there is, I'm seeing someone here, David Paul Zimmerman.
That's my
Says
dad.
that, hi, David, how are you? You have a brave daughter, and despite her injury, which I have seen patients who have slight abnormalities or injuries after vaccine, and I've seen them very frustrated, very nervous, and very angry. Here we have your daughter who's going through this for now a year, I believe, and this is not a trivial injury. And not only she's educating us, not only she's making an effort, but as she discusses it, she lights up, she laughs at various places. She's not venting, she's not, I'm sure that she has disappointments and I'm sure that she's sad about it, but she's not spilling that over to others. And that bravery is commendable. And of course, the parents themselves have something to do with that as well. So, David, thank you for being here. And Michelle, thank you for being here.
I
So,
owe my
David
life
says,
to both of them, both of my parents, because I've gone from being independent to having to be cared for 24 hours a day and driven everywhere because I'm not cleared to drive. So multiple appointments a day that they've given up time of theirs to. I hope that that goes away at age whatever that you're independent, but I'm forever grateful for them.
so David says, Michelle has never had COVID. She has had many specialized tests that have documented never having COVID. Thank you, David. And we'll continue. So here is rocket surgery.
And this is just going
Is
back
this
to the,
you?
yeah,
Here?
it's me. Yeah. I was invited to speak on artificial intelligence at Scientific American Macmillan at the New York Academy of Medicine. The girl sitting next to me to the right of, or the picture, is one of my students who was planning to be a doctor. So me looking at these different areas of what could be going on is not just something new because I've been injured. It's something that I've been looking into for years, and with my students, knowing that we need a new generation of young people who will tackle and work with these problems when there's ambiguity. There was a book John Medina wrote, Brain Rules, and there's a section in it. He said that if you look evolutionarily, we did not come with manuals. We didn't have an answer key in the back of the book that told us what steps to take and what to memorize. We worked through chaos and we worked through ambiguity to try and solve problems. A lot of education, and even as it's gone over into medical schools, has taken a different approach and looked at symptoms and things that have happened to people that have been well established and known for a while, and then trains people to recognize those, to test for those things, and then to establish and treat those. COVID threw everything out the window. So people who have been specialists for years and knew their areas so well are all of a sudden thrown with something novel. And so what I want in my young people, my students, is to be able to attack a novel situation instead of throwing up their hands and saying, I don't know, it's not in the answer key, or no one's found out the answer, let's wait for the person to find out the answer. To have a group of dedicated citizens who are saying, we care about this enough because science is important to us. We want to make sure there's protection for people and health equity. And how do we make sure that happens? We know that technology and human curiosity together can really make a difference in those areas. And that's one reason that I'm very much invested, because I know it's not just me. There are people before me who have ME/CSF, other mysterious post-viral conditions, but this is the first time I'm experiencing something that has identical symptoms, that I have a depth of empathy now that I wouldn't have had it not been for the severity of the reaction after this injection.
Very well said, Michelle. And once again, I'll keep praying during this, so please don't be. So wish you well and good luck. So here is what is physical phenotyping and why?
So from that picture of talking about what could be possible in the future of medicine with my future students and when they have their career someday, I'm now seeing AI unfolding in medicine in a way that is fascinating to me because it's now very relevant to me to be able to look at different blood cells and how they're responding in different areas, to be able to phenotype them and then try and understand, is there enough distortion or deformability that a blood cell can make it into a small capillary? What happens if you don't get blood flow? And that's something that I've been working with my students, and I was thankful at University of Washington in pre-med that my professor was very clear with us that she wanted us to say what causes and keep tracing it back and back and back until you find it rather than treating a symptom. So like I said, this is still part of who I am. And in the Deep Medicine book, there was a section that talked about the benefit for medical professionals learning art and going to art museums. So I wanted to tie that in with that image, the sculpture of how I felt and the type of empathy you can gain from art museums, but also that I've been establishing that in my students for years. These were back from around 2014, 2015, not only drawing structure and function, but then trying to create structure like a rib cage that's strong enough that can hold the weight of multiple physiology textbooks and neuroscience textbooks. And so that they can start appreciating the complexity of those things where you think about sculpture, you think about drawing. And a lot of times in science, people will say, well, no, we only need the data. The data is usually seen as quantitative data only. But when we start getting people to think about the ranges of data, the types of information you can get from photos and art and image to understand in a different way, our brains have the capacity, when they're functioning normally, to be able to do these kinds of things, and that those ultimately can help go towards solving problems like this.
So, Michelle, there is a question here, which I think we have the answer to that later in the discussion. But if we could inject maybe a summary of the answer here as well. So the question is RJ Fuentes, if I am pronouncing his name or her name correctly, what treatments have you had so far and how's your experience with all those treatments? So maybe just a summary, we'll look into those later on as well.
So for the first 6 months, nothing, because understandably doctors didn't want me to treat something where we didn't know what was going on. Maraviroc and pravastatin, and that actually did mediate quite a few of the symptoms where I could stand up and actually be alert more than being asleep 12 to 14 hours a day. Quite a few symptoms that haven't come back since. Binasal occlusion is considered a type of treatment. So that is a non-pharmaceutical treatment, but helps orient my brain with my eyes to help heal. Hyperbaric oxygen, I just started that recently and I've been surprised. I didn't expect to notice a difference within about an hour following a hyperbaric oxygen treatment. It feels like lessened brain fog and I can typically speak a little bit better. I've tried a whole range of other natural types of things, and prior to Maraviroc and pravastatin, and didn't feel like it moved the needle at all. I'm one who goes for preventative medicine first, like being really healthy, eating healthy. I wanted to protect my brain with not drinking alcohol, not drinking caffeine, very low sugar, healthy exercise, things like that. So that's what I wanted to try first. I went for things like turmeric and anti-inflammatory types of supplements. I've done vitamin D, I've done vitamin C, vitamin B. Vitamin B, methylated B, actually has made a difference with headaches. That's something I think is one of the most valuable supplements I've had. Standard B didn't make a difference, but methylated did. I'm trying to think of what else. I'm currently taking fish oil because I know I have vascular inflammation and vascular damage. We do know that there's a lot of research on fish oil. And then there's something that's called astaxanthin that is a high antioxidant.
Got it. Thank you so much. And going back to the discussion.
And so it's been something that when I was in my graduate program and people said it was a waste of a PhD to go teach kids, it's absolutely not. Everything that I learned from pharmacology to neurobehavioral to child development, human development, all of those became absolutely crucial for leading and navigating a school during the pandemic and being able to collaborate with all these groups. But even before that, students of mine have gone through the National Academy of Future Physicians and Medical Scientists. And then when we can start getting young people to know how to communicate, collaborate, to notice patterns in things, to connect them across domains, situations that come up like this, like COVID, that have huge challenges. Even once something is developed scientifically, it doesn't stop there. It's a design thinking process. There are multiple iterations of design. And that's what I hope people come away from this, that I want people to think about vaccination as crucial and important, and that it's a multiple iteration of design. So in that iteration, what I teach my students to do is find out what failed, what worked, what didn't go quite as we thought, but worked pretty well, and how do we readjust and redesign. So in any good design thinking process or innovation, you should have multiple iterations of design. And rather than saying, it was perfect the first time, we never adjust anything from there again.
Very good point. And I wish that they had done that with the vaccines. It doesn't seem like they're doing it a lot. I think Moderna is making new iterations. Pfizer is now trying it, but still these iterations are kind of following or chasing the virus mutations, and not actually if there is anything in the vaccine that may be causing injuries, and then to go and fix that. If I can ask you a question, Denise says, any antihistamine or mast cell stabilizers?
The antihistamine I had was the injection day. They gave me no, actually that was a Benadryl. It was not a histamine. I haven't seemed to have typical histamine type of responses of the symptoms that you'd see there. I just saw the comment down there, made me chuckle. And so I've seen people with histamine responses, and mine don't match that same type of pattern. So I haven't seemed to need those.
Got it.
It's beautiful. I love science. I had to put this in there because I got so excited. I will say, if you have vision, if you can see color, if you can see dimension, and you're frustrated with everything else in life right now, I want you to be thankful that you can see things, because I realize how precious vision is when it starts going. And I don't want people to take that for granted, but to just be in awe of how complex all of this is. And I know some people are saying, why aren't the doctors or researchers working fast enough? There are some who are working incredibly hard to try and figure out even this little complexity right there that you're looking at. There's so much to that. And there are people putting their careers on the line to try and help others. And I want to thank you, Dr. Drbeen, because you are helping advance collaboration and understanding of things in different ways that wouldn't happen without this type of communication.
My pleasure. I'm just a very, very tiny cog in this whole thing, but I'm happy to be of service. And Michelle, this picture, thank you for sharing it. I'm a doctor, but I had not seen this before. But when I look at it, this is a mitochondria. These are various vesicles. These are microtubules. I even saw this little kinesin attached to a microtubule, probably running around with some cargo. And then these probably are some endoplasmic reticulums and Golgi apparatuses. Beautiful picture. This is a gap junction, and the threads through the gap junction to bind two cells together. And these become cilias and others. So anyways, this is beautiful. Thank you for sharing this.
That's part of what I'm doing and trying to find out answers for myself, like this one, because I love science. I refuse to believe being called collateral damage is all there is. It was shocking, the first rounds of people who told me that. They said, you're vaccinated, there's no help, you're going to get no help. And because of the research background and because of all the ethical training that I went through, I thought that is not possible. There has to be some safeguard in place. And so once I realized that what they were saying was very accurate, that there were no safeguards in place that were functioning and not accessible, that one medical professional said to me, just come to grips with this, you're not going to get any help. But if you care enough about other people who come after you, fight with everything in you so that you will keep looking to find answers, so that people who come after you will maybe not suffer as much as you have. That's what I care about. That's what I want to teach my students about. That's good. I get choked up there because it's what gives me purpose to keep going when this is terrifying, difficult, and to be pitted in a place where People will ridicule you for saying the severity of your symptoms, where they would never do that to someone who is in a hospital bed with COVID with as severe symptoms. They wouldn't yell at them and say, you're a horrible person, you're obscene, you are the excuse for millions of people not getting vaccines. That wouldn't happen because of the pressure of that kind of weight on people like me who've been vaccinated to either be pulled to try and be used as a poster child for an anti-vaxxer, or to be ignored because I'm a counterexample now, and it only takes one counterexample to disconfirm a hunch or a theory. And that makes people uncomfortable if it's said that it's only safe. There's no possible reaction to this. Counterexamples are not comfortable. I say this because the pressure is so heavy on people like me that people are losing their lives. They're dying by suicide. They're losing their finances. They're losing their livelihoods. They're losing the jobs that they loved. And I have lost the whole year with my students, but I'm here now because I will fight with everything in me to try to help other people not go through the suffering that I'm going through now.
Thank you, Michelle, and bless you and give you more strength, and hope that you can not only find a solution for yourself, but become that beacon of light for others as well, which you are right now.
So people might say, well, how are you doing research at this time? And because of the AI background, I at least knew about tools. There are free tools from Microsoft that I'm sure a lot of doctors don't know about, but this could be a support for people. It can read articles for you. It's immersive reader. And I've been importing medical journal research studies and then having it read to me, or being able to highlight the words so that my eyes can track. And so at least be aware that some of those things are there. If you hear someone who comes in and says, I can't read, look for other options for them. Because we shouldn't be adverse to adverse events. And I loved this quote because good science doesn't get scared of a counterexample. Good science doesn't get scared of data that doesn't match their hunch. They ask even harder questions and say, what can we do next?
And Michelle, Dr. William Murphy was with me yesterday from UC Davis, and he is amazing. And this is just by chance that you brought up his quote as well.
And so, like Dr. Bean mentioned, that I will still laugh and I will still smile because I have purpose to live, but this is serious. It's over $365,000 in financial losses between lost work, between medical bills, between costs that have been associated with other types of treatments that are not included in insurance. I've been fully medically disabled for almost 15 months and counting. I will not be cleared to return to work until I'm cleared to drive again. I have not even been cleared to travel, and I got my vaccine when I did because I was hoping that I'd soon be able to meet a new family member, and I still haven't been able to meet them. My disability inventory is still 74 out of 100, for 100 being the highest in vestibular and some of the other functions. The burden of proof is still on us. I mean, at this point, we do know, and there's public record and clinical trials that show that there have been adverse reactions, but that information hasn't been updated yet for medical facilities, for insurance companies. And as I mentioned before, we wouldn't walk up to someone who was severely ill in an ICU and say, well, prove it, prove that you're ill, prove that you have brain injury. Not only do you have to prove it to me, but you need to write it down in documentation and find medical references to back it up. But this is what's happening every day to people who are suffering severe adverse events, and most of them aren't getting any help. Part of the reason why I have gone so much to try and find understanding, to try and piece things together, is because I know there are other people who don't have the background, don't have the resources, don't have someone to help support them like I do my parents who are taking care of me, to allow me to use what little cognitive energy I have to try and help find answers, to help pave the way to connect these things, because it's not good enough to say, oh, it was too new. That's causing a problem in the message that we want to send people as safe and effective. You can't say both at the same time. It's safe and effective enough to mandate, but it's too new to do anything to help you. Those two are in conflict. So if it's not too new to mandate, which does help save lives and decrease hospitalizations, there should also be not too new to be able to help people who have been injured. And that's where it's not good enough to say, well, maybe in 8 to 10 years, we might find maybe 1 or 2 answers, but we probably still won't have treatments for you. So while I'm debilitated at home, while I'm not cleared to go anywhere, where I can't travel, where I can't work, where I can't even drive myself to the grocery store, I'm using AI to try and find everything that I can to find answers, connect people to, I've been interviewing people for a year as researchers, people on the cutting edge, trying to find puzzle pieces and put them together in a way that will hopefully spark curiosity for the next round of researchers and clinicians who are going and trying to find answers, so it can maybe shorten the time instead of 8 to 10 years, maybe in 2 to 3.
And Michelle, talking about your effort and this message that you just gave, a friend of mine, his relative became vaccine injured, and he developed severe GIT issues after the booster. So he was fine after the first one, second one, booster somehow started this. And so he reached out to me, and I said, I don't practice here in the US. And he said, could you talk with my doctor? He will be, it will be useful if he knew what is going on. And his doctor actually simply plainly refused to talk with me.
Yeah.
And so there was not even an ounce of curiosity. And so then I asked him separately, I said, fine, he didn't want to talk with me. That's okay. Did he go on a journey to figure out how to help you? And he said, no. He has given me Imodium, and that's about it. So there is that as well. So hopefully your work will bring things to light. Sean's work, Bree, we met a few days ago. So there are so many patients who are, as you're saying here, the burden of proof at this time is on the patient. So thank you for doing this work.
And we can go through these next ones really quickly. They're just, for all the people out there who are saying this isn't possible, you're making this up, I've put together quite a few slides that are screenshots, images of, this one's directly from the mass vaccination site run by King County Public Health and King County and Seattle Public Health, identifying that I had a clinically significant adverse event at the time of vaccination. It's in public record. I had to do 339 pages of medical research, of tests, exam results to submit to my disability insurance, because they said nothing had been updated that it was possible for a vaccine to cause an injury. And even with all that, they still said, well, we still don't have enough yet. And it took until getting quantitative biomarkers from IncelDX that they finally said, okay, we see quantitative data that shows this. But there needs to be something that has connection pieces, because that transfers all the way down to health insurance. So people say, well, that's fine. You get vaccinated, you get an injury, fine. You've got health insurance that will cover you. No, it won't. Not everyone's. Mine isn't one. The ones on the side are 8, I think it's 8, maybe 10 now, different requests for assistance from the Office of the Insurance Commissioner. The image on the side from that tweet is the actual document from Washington State Governor mandating vaccines for K-12 educators. So even though I got mine early because I wanted to be a model for this, had I waited later, I would have had to be mandated to maintain my job anyway and would have had to get it. But the insurance companies are under the impression that vaccines were not part of emergency orders and therefore didn't need to cover health coverage for injuries that followed. That needs to change. If we want to maintain a strong vaccine program, we need to know that people have some fallback plan. They can be cared for if something goes wrong. Those are the changes that need to happen now. And it's kind of hard to see now while I'm talking, but I have gone through every possible test imaginable at this point. For something that was free, safe, and effective, the cost is astronomical, the time is astronomical, to be constantly poked and electric impulses going through you, being injected with radiation. How many different things that I've gone through for people trying to say it couldn't be the vaccine, there must be something else wrong with you. And test after test after test after test says unremarkable, unremarkable. This is strange because a vaccine can't cause this. But as a researcher, the only reason I could be okay with the amount of what I was going through physically was because if someone says you can't prove it, then the first step is to disconfirm all possible other scenarios. to know what was or what isn't, because maybe there was something underlying that no one found. But it's been almost 15 months and still no underlying condition. So if you can gather and rally people around you to say, good science looks at the data, good science doesn't get shaken by counterexamples. Instead, say, let's compare people like me, who we've already ruled out a lot of different confounding variables where they say, well, maybe this, maybe this, maybe this, all of those have been ruled out. Compare people like me to actual long COVID people who had the virus, and then say, what are the commonalities we have here? What are the differences? What are the things that may be driving the viral component of the aftermath? And what are the things that may be like a cytokine response or an inflammatory response? From there, that can help narrow down and focus what new iterations of vaccines we develop to target those things and decrease some of the reactiveness of some of the vaccines for people. And this goes back to that idea of wanting there to be safeguards. I'm thankful for British Medical Journal, who they are incredibly detailed in fact checking. They had more than 300 pages of documents for me, phone recorded calls that they got approval to record. I got approval to record calls that they asked if they could listen to verify all the information. And it impressed me because I saw not only a transparency, but a willingness to look at the data and the gaps in the system to try and make changes.
Thank you very much.
And I'm also doing this because I know there are entire communities of people who have had post-viral, MECSF, mysterious conditions that haven't been diagnosed before. And that if there's a chance, some of this can move the needle for the people who have been suffering for years and people haven't believed them.
So I'll give you on this one. There was a young woman who reached out to me about a year ago, and she had developed an injury after the vaccine, and she was not getting any help. So she called me from another place, and she said that I have this situation. And while telling me her symptoms, she said, I don't want to live anymore because it seems like she had neurological symptoms. I have developed brain damage and I don't think it's going to fix, and doctors do not know what to do, and I'm yet very young. I cannot live like this. From there, in about a year time, she has now become, I would say, about 90% recovered.
Wow.
And now she gets bothered with the tiny things, but that was a turnaround from someone saying, I want to die, to now getting bothered for a small remnant. So thank you very much for bringing this hope. Those who have long COVID or who have vaccine injury, please hang in there. There are so many people, as you can tell, working to bring hope and solutions. And I am only bringing a broadcast. So my role is really tiny. It is folks like Sean and folks like Michelle and so many others who are working on it. So thank you
And I want
Michelle.
medical professionals to know, any of you who are listening, the smallest word of hope or the smallest word of, I don't know the answers, but let's keep trying to find an answer, those can make the difference between life and death for people. And I've actually seen it happen in this time. There have been people who have gone through doctor after doctor after doctor who said, no hope, there's nothing we can do, or worse, you're crazy. This is all in your head, you're making it up. And those people, with a combination of the severity of this, plus losing homes, plus not having anyone in their life to believe them or take care of them, have gotten to the point of saying, the thought of trying to live with this and the severity of this is worse than the thought of not being able to live anymore. And that's why I got choked up earlier, because there is a public health crisis that is not being seen. It's unfortunately, even known data is not being updated with tech companies. So they're labeling people as misinformation who actually have suffered severe medical injuries, who have medical documentation that show that. And it's leading people to need to actually speak in code to each other to try and get help, to not lose connection with the people who are suicidal. I got to the point of, I called 15 different counselors across Pacific Northwest and other areas in the country to try and find out who would work with people who have vaccine injury. And person after person said, I don't work with people who had a reaction to the vaccine. And I said, who does then? And there was no answer. So even to that level, if there's one person, one doctor in someone's life who says, I believe you, we don't have the answers yet, but I believe you, that can make the difference between someone living and giving up all hope.
Thank you. And that is very powerful and that is very true. And this is actually, I have seen patients who are standing and crying. And when they just listen to this, that, okay, let's work on this together. You're not alone, smiling.
Yeah.
So yes, you're correct. This is a difference in life and death.
This other one is fine. I wanted this image up here because I really liked the way translational sciences for the National Center for Advancing Translational Sciences positioned this. Ideally, in the best perfect world scenario where patients are in the center and research, preclinical research, clinical implementation, and public health all are intersecting, where pieces are not missed between those cases, and then there's a dissemination of findings. In all of these pieces together, I started out by needing to prove that this was happening to me to try and help myself. But when I saw how much I had gathered, I thought there are people who won't have these resources, who won't be able to connect the pieces, even doctors. I say that because doctors and nurses are so busy. They do not have time to go scouring the medical research. And so if I could help connect the dots and pieces and at least bring them together in a way that would help decrease the time or the amount of workload for someone to get started on this, that's something I could contribute even when I'm stuck here and not able to go back to my job. It's one of the big reasons why I'm actually going through with publishing, and the proposal's gone through medical peer review, board review, editorial review. It will be solidly medically peer reviewed before it goes public. And we'll gather some of this latest research that is coming out daily. There's so much out there, that's why I've been grateful to you, because especially days that I couldn't read at all, being able to hear you go through the studies and be able to take a mental note of those and know that there are doctors and nurses and researchers who are so busy that trying to even scour and pick out the studies, to know that there's at least something that's captured that they can even listen to as they're driving somewhere, to be able to have that as a piece of this publication, so that there is an electronic component, that it allows for people who are going through injury, who are medical professionals who still want to contribute, who are people who care about policy and public health and law, and then have a base of this information. So I think it's okay to let them know that I'm highlighting some of your videos in there because it explains so well.
Thank you very much for the plug.
And then I wanted to highlight this because I've been following Dr. Akiko Iwasaki for quite a while now, and I've been very encouraged how she really wants to communicate with people, not only for hearing their symptoms, but said that she would not have known some of the details had it not been for communicating in social media in different ways. And so I'm encouraged that this study is not only long COVID, but is also including post-vaccination severe adverse events. So if you're someone who knows someone who's going through that, I encourage you to go to the Yale Listen study and sign up for that and at least be heard. There's still not an answer to it yet, but first step is listening and finding some of those parallel pieces.
Got it. Thank you very much. So if somebody is long COVID or they're vaccine injured, they could join this study.
We can go through these ones very quickly because I think I've gone over some of these already. Just all the highlighted pieces. I didn't understand that anaphylaxis could be gastrointestinal, cardiovascular, skin reaction. I knew skin reaction, but a lot of these other ones I didn't know. I experienced all of these within hours of my injection. And I found out later that I was supposed to be given an EpiPen immediately and sent to the emergency room, and neither of those things happened. I was told that there was no possible reaction to Johnson & Johnson. They said, unlike mRNA, you're not even going to have anaphylaxis. So when I said my tongue and throat were swelling, it was kind of like a and Benadryl, and that was it. So be alert and aware that if you see a range of those symptoms, these symptoms as well, I went through every single one of these except for the bloodshot eyes. And I didn't go gray or blue colored skin. I don't know when I was unresponsive, but when I called in later and said, I think that these symptoms are going on with me, it was just like, well, that's not possible. You must just be tired. Just take some ibuprofen. And since then, trying to find out more of where is the disconnect coming from, the amount of research that's out there. Brighton collaboration is what is being used for clinical trials for diagnostic criteria, among other things. And on the bottom corner, I've documented my fever, how long my fever went, 9 consecutive days. And then I noted some of the diagnostic criteria that was outlined in the Brighton collaboration that would constitute multisystem inflammatory syndrome. And that those things exist, they're already out there, but they've not been updated yet for diagnostic criteria in the CDC, so that when doctors go to multisystem inflammatory syndrome diagnostic criteria, they'll only see previous diagnosis with COVID, not previous or recent vaccination. So when people present with these symptoms, they're like, we don't know what to do. It's a bizarre constellation of symptoms.
And you had this?
Not been diagnosed, but I meet all of those criteria.
Got it.
There's currently no way for a doctor to diagnose it because vaccination.
That's what I was thinking, that medicine has not caught up to that.
Correct. Even though this is a screenshot from the emergency use authorization for Johnson & Johnson, mandatory requirements for giving the Johnson & Johnson vaccine was to report all serious events, cases of multisystem inflammatory syndrome, and yet it's impossible to report multisystem inflammatory syndrome with the current diagnostic criteria we have because it doesn't include injection. One of the first things people said is, oh, well, you are clearly allergic to polysorbate 80. I didn't think so, or PEG, because I've used products with both of those before, but we've ruled that out. This is my allergy test that I am not allergic to polysorbate 80 or PEG. For multiple levels. And then so this next series you can just go through quickly. It's every single possible, not every single possible, multiple tests from HIV negative to mononucleosis, Epstein-Barr negative, Lyme disease negative, celiac disease negative. What was that one up there? Hepatitis negative. And I wanted to put this one in because, you can go to the next one, yeah. Because people said, well, you must have had COVID because your symptoms looked identical to a COVID patient. And I actually wondered that for a while because it was identical to what I've been hearing. So I've had so many tests. Just because I'm a researcher, I like data. I did a baseline of IgG, IgM even before getting vaccinated. Both were negative. So I know I didn't have it before. I had a PCR before my vaccination. It was negative. And then every test afterwards has been negative PCR, negative antibody to spike protein. People can argue, well, maybe you just don't seroconvert. This we have evidence for is not the case because I had a very rapid response to antibodies to spike proteins. For people who are not familiar with it, the little yellow things sticking out, those represent the spike proteins. And the inside of the virus represents the nucleocapsid. So if you get a test that has a combination of spike protein, antibodies, and nucleocapsid, if you have negative nucleocapsid, then you've not been exposed to the center of the actual virus. But the spike protein antibodies are indistinguishable between the real virus and vaccine that gave your body instructions to produce the spike protein. So you can see on both of these different research studies by Seroimmune that I did not have natural infection. It was vaccination only. And then that first column is my sample. So you can see antibodies to 3 types of spike glycoprotein, but none to nucleocapsid or any other type of actual virus in that bottom corner. So between this one and one other test from another research group, they found antibodies in actual spike protein in my non-classical monocytes. So it's like inter-rater reliability or corroborating evidence between 2 groups that didn't even talk to each other that found evidence of more than one type of spike protein, but not nucleocapsid or any evidence of any COVID.
Thank you. And before we fly through this, I wanted to share, somebody was saying that it would be great to have the link for the BMJ report. So I have pasted the link in the description in the comments, and here is the BMJ article as well. Here is Michelle.
And you can check
so
my Twitter, and a lot of these things that I have in here that are public resources, I've tweeted out already, and I can add others there. So if people want access to those.
Got it. All right. So let's go back here.
Shows high response to spike protein antibodies still through, that one was the December one, correct? I'm looking at small print. December 2021.
Yes, this is the CD4, CD8 ratio.
Right. That's another when people say, well, it must be that your CD4, CD8 ratio is off and that you're getting a reactivation of some kind of latent something, virus, fungus, whatever. But my CD4, CD8 ratio is normal. And so I've not had a reactivation. All of my blood work has never shown any sign of infection whatsoever. Still high antibodies to spike protein. And I can see that across time. That shouldn't have been that high that long. So that calls into question for any curious researcher, what's going on? Something is going on. It's not from getting another COVID infection, an asymptomatic infection. Otherwise, we would see nucleocapsid. It's not because I'm not seroconverting, because I still have high antibodies that were robust and quick response.
Yeah. So there is something that is continuously poking your immune system. Your immune system is continuously making the antibodies, and then there is continuous inflammation and biological reactions within the body.
I was able to talk to a microbiologist who had worked with the scientists at the Wuhan lab just before the pandemic started. And I asked him if he would look at my cytokine inflammatory panel just to see what he would say. And he said, this is fascinating. It looks like someone who's been exposed to very high levels of virus for months daily. But he said, there's no evidence of any virus or infection.
Yeah.
So this goes back to, as I was searching what is going on within the first 2 or 3 months, I stumbled on this one that came out a couple days after my injection. And I call it the gift that keeps on giving. And I reached out to the person who was quoted and I asked, what does this mean? Where did you get information? Is there some research that talks about what allows it to keep giving and increase over time? Because I was trying to find out if something still increases, is there a time where it will shut off? Or is it continually forever increasing? Never got any response to that, but it's just interesting that someone knew that something would keep elevating. And that was supposedly one of the pieces originally of why it did not need a booster. So it's curious to me why some people are not showing an antibody response or that it drops off really quickly, whereas others who've had J&J are still really high antibody response for over a year.
Yes.
This one to show primarily the, first of all, this is the test that my disability insurance finally said, okay, there's actually something going on. We can see it, quantitative data. As a side note, and being an educator, I liked the book, The Little Prince, and he really talked about how adults want facts and figures as the only numbers that they can get as evidence, but they forget to ask some of the other questions. And so I like playing with this idea of we need data that's quantitative. We need quantitative data that AI can help mine. And then we also need the qualitative data that describes the symptoms that go with it. Without it, you're not going to get a full picture. So the research teams that I really appreciate that are using AI are not just leaving it at AI entirely, but they're still asking questions when they see anomalies in their own data. And this is one that I've been talking with a couple of the researchers at InCellDX and said, there's something different about what's happening with SCD40L, where there's a response with some people with typical COVID long haul. But what I'm seeing with some of the Johnson & Johnson people is they're getting a different type of response. And I did hear that that group of vaccines has been harder to treat. So I'm one who's not going to let up on this until I find some kind of answer of what's driving this, because my CCL5 normalized after I was on the Maraviroc and Pravastatin. A whole group of my symptoms went away. For example, the gastrointestinal, I had bloody diarrhea, and I'm not a person who has diarrhea. And so when I mentioned it to my doctor and blood, he said, well, maybe it's just hemorrhoids. And I was like, there's no hemorrhoids, it's diarrhea. That went away when I was on the Maraviroc and Pravastatin, has never come back since. So that's one example of something. But there are the neurological symptoms that feel like they were not budging. And up until the SPECT scan that came up, we weren't able to specifically identify the blood flow problems, but this SCD40L marker gave a really strong indicator that there's some kind of vascular inflammation, and along with the vascular endothelial growth factor and the SCD40L, that there was something going on with the coagulation cascade and something going on with vascular inflammation. And the neutralizing antibodies, I thought there's no way I am going to keep seeing antibodies increase. So I was glad that I actually ran a second round of that, because you can see from August 2021, the neutralizing antibodies were 84.9%. But by February 7th, 22, the neutralizing antibodies were up to 90.3%. So something's not normal there. And that's where curiosity asks questions of what next.
Yeah. And just a quick disclaimer, we have, or at least I have, no relationship with IncelDX, no commercial relationship. IncelDX's team has appeared here, Dr. Bruce Patterson, with their research. That is the total relationship. There is no commercial or other such interest.
For me, I am a research participant that I did give them permission to use my blood in their studies. So if at one point when the vaccine information comes out, my data is in that. What I thought was interesting was seeing like patterns in people's blood, commonalities that I did show up on a long hauler index. So in the Science magazine article that said, well, we don't have data to be able to show that someone does respond like a long hauler, there actually is data. And there's data that shows patterns that are very parallel to long haulers. And then the one thing that I do appreciate in the design or the approach of their AI is that they are looking for the nuances in the signatures of the different combinations of inflammation to try and narrow those down instead of just across the board.
Got it.
And so those were two markers that were elevated in me, and they saw them correlated with neurological disability, which is also what I'm experiencing. That was consistent. So these were some of the things that I wrote to my primary care physician after September month on Maraviroc and Prevacid, that my skin lesions and oozing and bleeding went away. I had 4 days in a row that I waited to tell him, because for 6 months I didn't feel like eating at all, never felt the sensation of hunger. But for the first time, there were 4 days in a row where I felt hungry, and it felt strange to me because I hadn't felt it in a long time. And he told me that even though that's not a biomarker, to him that was huge, that there was some indicator that some healing was happening if I felt hungry. Prior to any of that treatment, I could not stay alert for a lot of the day, and I was sleeping 14, sometimes 16 hours a day. And then some of the light sensitivity decreased enough that I didn't have to stay in a completely blackout, darkened room. So if anyone's interested, that's what you can follow to see more information on that one. And then the next slide is a spike protein that they were able to find in monocytes. And this is where my data is in this also, because they were able to see spike protein in my white blood cells and the non-classical monocytes 6 months after injection with no COVID. That to me is compelling data that something is going on, that spike protein is visible where it shouldn't have actually been able to even do that.
And once again, disclaimer, this looks like IncelDX's promo as well, but this is not. These are just Michelle's tests and the progression, the journey she went through.
So just
back to you, Michelle.
Yeah, that's just the spike protein. You can move on. And I mentioned these ones too because, again, my interest in artificial intelligence and medicine, I went from talking about it to being a participant of that type of medicine. And so that's one reason it's interesting to me. I've noticed that none of the doctors that I've talked to have heard of SCD40L, and even a hematologist I spoke with recently who won a top doctor award. But it's been in medical research, including the American Heart Association, for 20 years. It's not new. So I think it's interesting that if people are in the medical field and haven't asked questions, or if they see something new, rather than dismiss it outright to say what exists out there, maybe there has been something that talks about this in the coagulation cascade. And the next picture just shows an image for just a really brief look.
Yeah.
I didn't have anything specific to say to that other than the other ones coming up are long COVID. In the next slide, that COVID and long COVID, we're also using markers of SCD40L to see coagulopathy, connections with some of the cardiac conditions, cerebral vascular conditions with stroke.
Got it.
to the next one. You see the epithelial, endothelial, vascular components of all this too. I mentioned some of this because as I've been watching some research come out, there's a strong focus to say maybe the risk factors for long COVID are severe hospital stay, or maybe it's because someone had diabetes, or maybe it's because someone was a smoker, or a whole range of things that they're coming out with. But unless they look at people like me who have none of those underlying conditions, who didn't have any of those risk factors, we're not hospitalized, we're not intubated, and still have the same reactions, you might miss out on some really important pieces of information. This is just, again, that vascular complications have been known for a lot longer than I realized. It took the audiologist that found out that I had vestibular hypofunction to say, you do know that COVID is a vascular disease, right? And I was like, it's a what? Up until that time, July of this last year, I still thought it was just a respiratory disease with a bizarre constellation of symptoms. And she sent me an article, and that set me off onto a whole direction of finding connections with some of the research there. So even when I had severe chest pain and having difficulty moving and checking with a cardiologist, and they said everything's unremarkable, it took 3 months to get a Holter monitor or a Zio patch, which another piece of beautiful technology. They did find some abnormalities in there that were consistent with what I'd seen in long COVID research and COVID research for PVCs, PACs, things. I might have just said that wrong, but speech. That they said it wasn't consistent enough for them to note something on there. So the recommendation was just start exercising quite a bit, and then you'll just like bounce out of it and recover. What I've learned since is that if you push someone really hard to exercise, it will make them worse if they're in a long COVID situation, MECSF, and that's pretty consistent. But it seems like there are a lot of people who are not aware of that and could be unintentionally harming people, hoping that they're just helping them bounce back, but it doesn't necessarily.
Michelle, would you like to take a break, or do you want to continue? Are you?
Thank you. I appreciate that. I will continue so we can finish up to whatever, and then I will crash afterwards.
Thank you very much.
If there are ones that you wanted to skip over or you just go through really quickly, feel free.
I am totally fine. I saw you talked about your speech. You looked a little tired as well. So these talks can continue to happen.
This one, I reached out to researchers directly, and Dr. Magro has been fabulous in providing information and looking over things for me. She has given me a lot of insights and connecting pieces that I wouldn't have thought of otherwise, even search keywords. So it's helped me dig into some of the ways that the vasculopathy and some of the problems with lung and respiratory have all connected together. And I'm incredibly thankful for the not only medical professionals, but researchers who are out there on the front lines trying to find answers for this. Oh, yes. And this series you can go through quickly because the next round is, oh, well, it can't be the vaccine. So you must have a genetic predisposition for coagulation. That has to be it. So I went directly to my 23andMe and went through because I thought maybe it's a possibility. I don't know. I've not looked at that for myself before. But it turns out that at least the standard ones there, no variants for genetic variants that were tested. When I went through all of these, I started digging into the medical research and then went into the raw data, figured out how to look for that and compare it to the studies, and no variants there for abnormalities. I did find, though, that some of the research that said the genetics that had the decreased susceptibility to ARDS, I do have that. So if I actually got COVID, I would have had less chance of ARDS or cardiac complications, according to that study anyway. So we do know that there's thrombosis, cerebral venous thrombosis in COVID-19 vaccination conditions, and that the adenovirus vector vaccines are ones that have shown those types of symptoms. It's documented, so this shouldn't actually even be a question at this point. I'm a little bit baffled by the number of people who try to say, well, that can't cause that, when we have peer-reviewed evidence, we have clinical data that demonstrate it. That shouldn't be a point to even guess or say that's wrong. And we know from, this is 2012, that oftentimes that there's cerebral venous thrombosis is misdiagnosed or mismanaged and not recognized right away. It's not always found on MRIs, especially if it's been a month since the event of something that occurred. American Heart Association says between 24 and 48 hours to be able to even see if there was a clot, unless it's massive. But any kind of microclotting or coagulation, you're not going to see. So to not assume, because you can't see something on it like that the person is normal and there's nothing wrong with them. So this
And
one,
Michelle,
yeah.
my apologies to interrupt you. This is one of the best comments today. Ellie Reed says, Michelle went beast mode on data collection. Here
Thank
for it.
you.
So thank you for doing this. There was another comment here which I just read from Jim. Jim said, she's not alone. Many others can't speak up like she can. So
That's why.
you are actually representing a lot more than just yourself.
That's why I'm doing it. If it was just for myself, I wouldn't. And I actually thought originally, the way some medical professionals said, I thought, well, there must just be something wrong with me. As soon as I found there were thousands like me and undercover, because of fear of being called an anti-vaxxer, because they got the vaccine to protect others, because they got it because they trusted science. I realized that it wasn't about me, and it was more about how do we make sure science advances, and how do we make sure there's health equity and that people are actually getting the help that they need.
Thank you.
So even though I had neuroscience background, I needed to, especially during memory relapses and brain fog and everything else, I looked to try and find all the images I could find to try and understand, because my MRI did have a note on it that said that there was a small and irregular flow for the transverse and sigmoid sinuses. And I thought, okay, so what could that mean then? Some people do have slightly different or asymmetrical, and it is a congenital possibility. But you wouldn't see the whole constellation of symptoms that I've experienced all of a sudden out of nowhere following a vaccine within minutes.
Yeah. So just a very quick note here. The sinuses, the venous sinuses, are kind of bigger channels on the side of the skulls, and they drain the fluids and blood from the brain. And so here, this is the transverse sinus, sigmoid sinus. It is called sigmoid sinus because it looks like an S. And it is transverse because it is flat or transverse compared to, let's say, these vertical ones. So this is the transverse sigmoid sinus.
And so this is the report for mine, and I just dropped an image over it that they were able to see that, but they said they were looking to see if there was CVST, cerebral venous sinus thrombosis, but they suggested that it was possibly congenital, but there was no follow-up either. And I found a research study that said if anything like that is noted, there should be some other kind of follow-up to see if there's investigation rather than leaving it. So thanks to Drbeen Medical Lectures, I was able to make some connections. This is not a sales pitch at all, but I had watched so many of his videos where he said you can get more lectures. And I felt, well, I'm not a medical doctor. This is for medical doctors and nurses. And one day it finally clicked and I was like, wait a minute. I'm actually going through all this medical research. Wouldn't it help me to actually see what people are seeing and what they're looking at? And it did. It actually gave me some connections that I missed between some of the research articles. And then looking at the one for cranial nerve 2, 3, 4, and 5, I saw that in my medical data, there was a connection between cranial nerve 3, vision, vestibular, and I was like, is there anything with cerebral, venous, or sigmoid and transverse sigmoid sinuses and cranial nerve 3 if there was less blood flow? And I found a whole series of research studies that I wouldn't have even found had it not been for looking at these medical lectures and going, wait, there's a connection there.
Thank you very much for having these medical lectures. And thank you very much for bringing it up. And glad that these were helpful.
So I looked at some other pictures, and this one was interesting because as I've been trying to figure out the vestibular condition, what causes the type of unilateral vestibular hypofunction that I have. And I know infection could be one, blood clots could be something. We ruled out infection. They said there were no blood clots visible. So I thought, what else could be a possibility? And this was interesting because this study said cerebral venous sinus thrombosis could present as mimicking like a Milner's disease, which would have very similar symptoms to a vestibular condition or labyrinthitis. And it has a vascular etiology. And I thought that was really fascinating too, because we already found out that I had vascular inflammation. We already know that I had coagulopathy. So it's within the realm of the possible.
So you had to do all this research.
Yes.
A patient who is vaccine injured, who has brain injury, finds it difficult to read,
Yes.
write, listen, have cognitive issues, visual problems,
Yes.
balance problems, dizziness, disorientation,
Yes.
runs in the walls,
Yes.
and you are doing all this research.
A lot of it from on my back in a dark room with my iPhone and
Wow.
using AI
Thank
tools
you. Wow.
under a cover to black out all the other light and sound. So just as that line of you can't prove it, then what do you need to do to disconfirm all possible other cases if it's like a differential diagnosis? I thought, what other ingredients are left in this? We've ruled out other infections. We've ruled out other underlying conditions. The only thing we have left is vaccine. People acknowledged it then. It's on my medical records. So what in the vaccine? Because I was told the severity of your vaccine reaction, you cannot take another vaccine in your life. Some people will be like, oh, good, that's fine. That's not what I want. I'm not here because I'm an anti-vaxxer. I want to follow and be able to look at the data. If I can isolate what ingredient was that caused the problem, then maybe I have hope for being able to take another vaccine in the future, as opposed to having to get medical exemptions. So the only thing left was the 2-hydroxypropyl beta cyclodextrin. Ooh, that was a first speech.
2-hydroxypropyl beta cyclodextrin.
Thank you.
Got it.
Between that and then the actual antigen were the last two left. So I went to the manufacturer directly. I talked to Janssen. I said, can you give me the most accurate information that you have? So I wanted to find the formulation to make sure I had the accurate. I looked at their EUA for healthcare providers to make sure I had the accurate terms. And then I started searching to see what was known about these ingredients. No doctor I had knew what those ingredients were. No journalist that I talked to had ever heard of it. It was bizarre. So I was thinking, how is there an ingredient in here that people don't even know what it is or its function or purpose, including medical professionals? Janssen said that they couldn't tell me. I don't know why, but never got any direct information from them. Everything that I'm doing, I'm trying to go directly to the source so that it's not a secondary or from someone else. So if it's something I have a question from FDA, I go to them. If it's for NIH, I go to them. If it's a CDC, them. I go to FOIA's, Janssen directly. And this one I cannot entirely rule out yet because I found 2 studies that talked about the ingredient, one as being seen at higher levels, but causing damage to auditory and vestibular. So it is possible. It's within the realm of the possible. And then the other one that we know it spikes localized inflammation. And if that was the purpose in the ingredient to try and get your immune system to respond, hopefully localized area, that it could have helped start spike localized inflammation that could have set off a chain reaction of an inflammatory response. So I have not been able to rule this one out yet, and still not any other information from Janssen other than the ingredients list in the EUA.
Got it.
So as I've been trying to find out, because tinnitus is, and I hate to say it this way, but a killer. It's devastating for people. I'm thankful that I don't think mine is nearly as severe as some of the people that I've heard, because there have been deaths by suicide for tinnitus alone. And so that's been something that's been top of mind to try and see what mechanisms of action might be causing this. And I did find this one that showed that spike protein could make it to different areas of the inner ear and could cause inflammation in endothelial cells. And so if we know that inflammatory response can happen and lead to various different auditory conditions, hearing loss, vestibular conditions, then it is theoretically possible then that a spike protein could make it somehow there and lead to inflammation with that alone. Otherwise, coagulation to not allow blood flow to those areas, not getting enough oxygen to those areas, could also theoretically, in the absence of a virus or clots.
Yeah. And just very quick orientation, this area has the semicircular canals. This is part of the internal ear, which is connected to balance and orientation. And then this seashell looking structure is the vestibular cochlear part, and this is with the hearing. So this is also internal ear, and there are ACE2 receptors there. So if this spike protein can bind with those cells, it can cause inflammation and dysfunction.
They checked all the structures of my ear and said there were no crystals. Everything was normal with the structure, just like with my eye. Nothing wrong with the structure of the retina or optic nerve. Structure was fine. So it's baffled people because they've said it's not like a standard case of what we've seen before, but they were able to determine from a caloric test and a VNG computerized test for me that it was left side. So I had left side hearing loss, left side vestibulopathy, left-sided weakness, a left-side increased blind spot on my left eye. So almost all left-sided things. My injection was in my left arm. So we've seen this one already, but this goes into the whole ear-eye balance and how going through vestibular and getting that has, you can keep going with images, thank you, has led me to vision. And then from vision to try and trace back what caused the vision changes, because that happened after being unconscious. So finding some of the TBI and vision connections gave me really interesting pieces of information. And I'm thankful for those researchers who have really tried to find ways to diagnose people who've gone through a lot already and realize that these same techniques can be used for people concussion from sports, from car accidents, from other types of accidents. And that if you can get at the information through vision, you can then potentially diagnose different types of brain conditions. So how did I burn my hand? This was very embarrassing. By February 1st, I was so embarrassed that my parents were having to do everything, including bringing plates, because my wrist was so weak still, it would just drop, even though I had done physical therapy. So I said to my mom, I really want to try and pour my own tea. I reverted back and I held the cup in my left hand and then picked up the boiling water with my right and was trying to pour it in. I thought that I was actually aiming for the cup. And I was so surprised when all the scalding water went over my entire hand. While it was excruciatingly painful, my wrist dropped because it couldn't even support the weight of the cup. So I looked at my hand, it was completely shaking, and as one would expect with scalding water burn. And I thought, I don't want to go into the ER. This is, first of all, embarrassing. But I looked up online and said, if you burned a certain percentage of your hand, you need to go, or body parts or whatever, that you need to have a medical professional evaluate it. So I did go in. Thankfully, my mom had me put my hand in a cold water bowl and brought it with me to the ER. But trying to explain it at the ER, they're like, "Now, what did you do?" And I said, I poured scalding water on my hand. Why? Because I was trying to pour it in the teacup. Do you have vision problems? At that point, I said, no, I have 20/20 vision. And even though I had just recently had that evaluation, it didn't click yet because I'd been told for almost a year, you're normal. There's nothing wrong with you. You're normal, you're normal, you're normal. You've got 20/20 vision. So in my mind, I felt so stupid. And it was this bizarre cognitive dissonance for me because I would never let my students call themselves stupid. And yet I thought, how can I not complete this simple task? It really bothered me until we did several other rounds of tests, and Dr. Cap and Katie, who are working with vision therapy and all these computerized tests, let me know what it meant to have a shifted visual midline. And so I'm realizing now that there may be quite a few other people out there walking around with long COVID, with other post-vaccine, with neurological conditions, who do not realize that their whole visual midline is shifted and think they're clumsy. It could be other kids who maybe didn't even develop some of the neural the same way other people do, and they're called clumsy with sports. And since I've been looking into more of this information, I've found some TED Talks, and I will repost those on my Twitter as well. But they talked about what a high percentage of kids will have not both the signals between brain and eyes working together, so they're slightly off, or having a shifted visual midline, and it has nothing to do with acuity. So a teacher could say to a student in the classroom, you're not paying attention, you're not focused, you're not reading well, you're not doing these things, or you're clumsy. And the whole time it could be visual processing or some kind of neurological condition. And it made me realize in that moment that as I was trying to get over feeling stupid for a couple of weeks and having multiple people, including my parents and vision therapists, saying you are not stupid, you have a brain injury. It took a long time to get that through my head. And I said, but they said I'm normal. And they're like, you're not normal. Even hearing that helps immensely. But it made me realize that there are likely far more people going through these symptoms, and they sound crazy and they feel like they're stupid, and there's actually something wrong that people aren't aware of. This is the biggest reason why I wanted to focus on these symptoms here, because I've found just within the last couple of months, several people local in my area who started describing visual symptoms like mine. And I said, if you're willing to, would you go to see the same eye doctor? And they said, but I've seen multiple optometrists. I even see a neuro-ophthalmologist. The structure of my eye is fine, everything else fine. But I said, did they test for this, this, and this? And they said, no. So they went to see the same vision specialist I did, the same vision test, the same reading test, and turns out they have the same or nearly the same thing I do, all post-vaccination. So it's either lightning struck a whole bunch of times in a really small area, plus a whole bunch of people across the nation, plus some international people who've reached out to me, and it's just random. Or there might be something else to some of the coagulation or inflammatory response that can be leading to not changing your acuity or the structure of your eye, but the way that your brain is processing information. If you're one of those, or you know someone like that, you're not stupid, there is something wrong.
Yeah, and just to add to this, our brain knows things, especially our body parts, by something we call law of projection. So for example, if this is my hand and I close my eyes, I can still go and touch various parts of the hand. So I'm not looking at it, but I still know where it is. And that is because all the information from the body going to the brain creates a picture in the brain's mind for where the body part is. And we call it a projection, that we project there. So sometimes when brain is inflamed or is injured, that projection cannot be done correctly. And so we think hand is here while hand may be there, or hand may be there and we think it is here. So that projection isn't correct. Then the other possibilities are that projection is correct, but coordination to reach there isn't correct. So that is a function of basal ganglia and cerebellum. They create a plan. Motor system says, go pour tea. And the basal ganglia and cerebellum, they talk with each other to say, okay, where is the cup? And how do we reach there? And how do we stop there? And how do we pour? So what are all the gestures and speeds and velocities? And they come up with a plan, and then they execute the plan. And so sometimes that planning can go wrong if cerebellum or basal ganglia, the motor cortex, are not working correctly. So there could be many reasons. So you are kind of smiling about it as well, but it is
It's
it was
serious.
serious.
I smiled because I imagine how funny it looks from the outside, from someone who's not doing that, and how bizarre it looks and how bizarre it is to describe it. And I smiled also because I was thinking back to the first test they were running with me with that, having me close my eyes, like first reach out and touch, and then close my eyes and then try and find the same location. I was completely off. I didn't even hit my landmark. And the range of tests that they did seemed very simple, but at the same time gave so much information that no one had checked for a year.
To me, you as a doctor, to me you sound brave. When I was doing my work in a hospital, I still remember there was a very young lady who got diagnosed with cancer. And so we were scared for her. But she was in the ward laughing and giggling and saying, I'm going to fight it. And there was so much inspiration looking at her, how she managed it. And so here I'm seeing another uh, young lady fighting through this. And not only that, in your wake, of this effort. You are collecting so much information that even doctors who would listen to this, who can get this, the hold of this PowerPoint, or who could just have a session with you for an hour, can learn a lot. So thank you for this.
Thank you. I can go through quickly with these. I asked Katie, who's my vision therapist, if I could share this because it was on the wall and I've looked at it several times. She said the bottom pyramid is what most people do to check vision. And they think if the structure of your eye is fine and the acuity of your eye is fine, you're good. But a lot of times with optometry tests, you have something that's narrowed your focus. You're looking through a machine, so you're really concerted effort of where that information is. You're not getting periphery, you're not getting motion or teaming or vergence or any of the things like the pupils fixation points or any of those kind of pieces of information. And I just checked with Dr. Cap before I came on here, and she mentioned about 70% of our sensory input is through vision. So if that's off, then it can cause a whole series of problems. And so when I was going through vestibular therapy, there's I think it's pronounced VEDA, VEDA, that my Dr. Mattingly, vestibular therapist, gave me first. And I couldn't even read at that point, so I couldn't go through them. It took until after vision therapy where I was able to get assistive reading things. And I saw that, and I heard her say before that if your vestibular system is off, your brain will try to rely on eyesight more for strong verticals and strong horizontals to orient yourself. But we thought that was happening for a full year, but apparently the broken vestibular system was relying on a faulty visual system, which was leading me to tilt my head to try and adjust. And that tilt was also adding to tipping over. And then the fusion with defective stereopsis is both eyes not working together to create 3D in the correct way, processing in your mind. So a lot of the things that I was struggling with vestibular were tied tightly into visual. A lot of the things I was struggling with speech and language were tied tightly into visual as well. And I had no idea how much vision could be connected with a lot of these series of symptoms that many people are getting medicated for to try and just reduce those. Some of the burning, severe headaches, so even trying to read or any kind of processing, I originally described it as feeling like a skin burn. And then when I burned my hand, I said, actually, it's exactly this. It feels like it starts by my eyes and then spreads over my whole head. And the only thing that would decrease that pain was putting my head in a hot shower, which seems strange. But then we figured it was likely because of blood flow changes.
Couple of questions. Jay says, have you been positive for autoantibodies? A lot of vaccine injured are sending their blood to cell trend.
That's
Have
one
you
I
had a test?
I haven't checked that test yet.
Is that your plan to do, or?
I think so. I think I want to do that just even out of curiosity. I did ask several of my care providers and they recommended against it only because they said they wouldn't know what to do when the results came back. But
I think
even
there are people who know what to do.
Okay. Even if there wasn't, I'm at the point where I'm interested to see what other data.
I think we should get, if you can. Super Alien says, how's Michelle's brain fog now? What's the treatment, please?
That's been one of the hardest to shake, the brain fog, the cognitive things. But I had someone suggest hyperbaric oxygen a year ago. And because I didn't know what was going on with my brain, I didn't know if pressure, if there was difference with blood, I didn't want to burst something. And until I had a doctor who really knew what was going on and looked at it, I didn't want to just jump into any kind of treatment unless there was something to back it. So it took until getting that SPECT scan. And that came because of the vision Dr. Cap from Specialty Eye Care and Katie, who I said, is there any other test I can do? And they mentioned SPECT. And from there, they were able to identify and then prescribe hyperbaric oxygen in soft side. And that has actually made a difference in not only nausea, but being able to persist longer with some cognitive tasks and reading tasks. And for about an hour after hyperbaric oxygen, it feels like there's almost a chunk of brain fog lifted. So it's not gone, but it feels like it's lessened.
Got it. Thank you. One more question. Michelle, so John says, Michelle, did you ever feel that when letting your story be known, people refer to you as a conspiracy theorist?
People will say whatever they want, but one reason I'm trying to go so detailed with documentation is because I'm invested in the science part of it and the research side of it and the data part of it. I am not interested in the politics. One has to have some involvement in politics because it has been made political, but I am trying to remove myself from that because I know there are other people who are working on that aspect of it. In terms of that, I mean like policy and things like the Americans with Disabilities Act and things like that. But that is a concern that people will make up whatever they want about you, and you can't do anything about that. What I care most about now, and this is thanks to my mom saying this, is it worth feeling uncomfortable speaking if it can make the difference in one person's life? And over the past almost 15 months, when I have posted something, even though I've gotten bashed and really horrible things that people will say who don't even know you, there has been at least one person on each post who has connected with me and said, so really this is something. It's not just me. All of my family, all my doctors are saying it's just me. If I can make a difference with one person feeling less alone, or one doctor saying, well, maybe I actually should believe that person, that maybe there is something else to this, then it becomes somewhat of a trade-off, I guess. I don't even know if worth is the right word because it's not okay for people to treat people that way. But it is a very delicate balance with this.
Meanwhile, in America, says HBOT effects have been long-lasting. How long did you have the HBOT, and how long the effects are?
I just started it recently. So the first week, I actually thought I was only supposed to do it once a week. So I went once and then wasn't in for 2 days. The first session was uncomfortable. It was more pressure in my ears than I was expecting. I felt dizzier afterwards, almost like I was on a boat. And I thought, this may not be that great, but I decided to stick with it. And I started tracking, just as I do with data and patterns of symptoms, as I have been for this whole time. And I noticed that the days I didn't go into HBOT, when I tried more cognitive load, I would get more nauseated. I would get the skin burn sensation. But as of now, if I do 3 days in a row, the third day I can be the most cognitively functional. But the results last for probably about an hour at this point. They're expecting that I probably need about 40 sessions before I check in with them again and see what the progress is.
Got it.
These are just some of the tests for any of the people who are interested in the types of vision tests that go beyond just acuity. These were what helped them define the directions and types of occlusion that I'm using. There's a center one where it shows up and down, where I looked at a bottom dot and then a top dot. My eyes overshot, and then the vertical and horizontal. You could see changes in fixation, saccades, and pursuits. Score is not ideal right now, but that shows that there definitely is what I was describing with my eyes. Something was going wrong. I zoomed out the picture of the brain on the side, just so you can see pursuits, what they're related to the cerebellum and parietal lobe, saccades related to cerebellum, brainstem, and frontal lobe, fixation. My eyes just went a little bit there. Neural integrator, brainstem, and then there are the muscles and nerves that are related to the movement in your eyes. Vision therapy has been fascinating to me. That and light therapy, that I wasn't expecting to notice a difference with either of them, but they have been probably the biggest game changers with the occlusion and the light therapy for headaches and the skin burn sensation and being able to actually stand up vertically without tipping. I'm not running into walls when I wear the occlusion.
Got it.
This one, this is how I made that connection between cranial nerve 3. Hold on just a second. My battery said it's getting low, but my computer's plugged in. Cranial nerve 3, how I connected with those videos that you said, and then being able to see how each one of those areas are identified in their accommodation: optokinetic reflex, saccade, smooth pursuits, vestibular ocular reflex, and visual fixation. All of those are things that I'm having problems with, and they're all connected to cranial nerve 3, which is fascinating to me because that did seem like there may potentially be overlap with cerebral venous thrombosis with the transverse and sigmoid sinus. And then you saw this one already, that it showed the level of reading and that there's some improvement. So we're seeing movement in that direction, still nowhere near normal ability to read and still excruciatingly painful to read. But that you see this in traumatic brain injury. So even though I couldn't get diagnosed because nothing hit my head, there was no impact, it has the same outcome. And there were several studies that I looked into that said it was either a blunt force that damaged tissue, or in some cases, the inflammatory response following it could change the way pathways happen and could have the same outcome as a concussion or traumatic brain injury. And for any of you who know someone who's had a brain injury, keep in mind that if they have difficulty reading, eye strain, headaches, vertigo, double vision, any of those things could actually be related to the neural component. And even if their acuity is the same, this could be going on with them. Long COVID, post-vaccine, or other kind of condition. You can see my blind spot on the left side is larger than normal. I'm waiting for a new neurologist that I'm seeing who said he may be able to identify the location of the injury in my brain by the type of blind spot. And then you can see on the right side, I highlighted that upper part. That's where I'm improving in peripheral vision. When I first did the test, I found out that they said it was the equivalent of me looking through a toilet paper tube for a full year because I wasn't having functional peripheral vision, but my brain filled in the pieces, so I wasn't aware how bad it was. I just knew something was very wrong with my vision, and it looked like it was shaking. It looked like a broken image stabilizer on binoculars or an iPhone. There are sometimes cameras, weather cameras that are put up for news stations, and wind gusts come by and you can see it shake, and I would try and point that out and said, that's what it looks like, but all the time. And then it is possible, there is hope. You can reduce the size of your blind spot through training, and that's where I'm seeing vision therapy helping. So one thing I hope happens with policy at some point, that when people see how many people are affected by this vision component, that physical therapy will include vision therapy as a component, as a go-to, rather than trying to medicate or tell someone that they're making it up. Light therapy, I found multiple in with brain injury, how it helps different aspects of the brain, whether it's blood flow or activating different receptors. I thought, how could light and pieces of tape and occlusion make that big of a difference? There's not even a pharmaceutical intervention, but they actually do. And so I've been fascinated by this and wanting to look more into the light therapy components and the different wavelengths, because there's a whole area that I haven't investigated yet on that area as well. So yeah, that's when they found more and added the occlusion. So this one is a VEP, and I had asked if, beside for the computerized test that presented similar to traumatic brain injury, was there a way to find out if there was actually change in signals? So she offered a VEP test, and she did find abnormality there and said that that was enough for her to be able to recognize that there was some kind of brain injury that had happened. So I asked if it's possible to determine if it was if it's still ongoing inflammation that's happening, or if it was a prior injury and it's just a matter of recovery, or it's just damaged. I'm hopeful that there's a lot of neuroplasticity that we know about now that people didn't think in the past, but as of now, we don't have any full realization if anything's going to get back to normal, or if I just get to a point of hopefully more functional.
Got it.
This is the visual midline shift for anyone who's interested in looking that up. Interesting, look, it's 1996. So again, that's not something that's very new, but it's been known, and somehow it's not making it to a neurologist. So the new neurologist that I'm seeing, I just had a first appointment with him. He was the first person that I ran into who knew what binasal occlusion was, and he knew how it related to brain injury, and I was so impressed. So several others that the interaction with a VEP, and then I didn't do it wearing binasal occlusion, but you can run those tests with and without, and then see the difference in the VEP results while wearing binasal occlusion. So you actually have data for people who want the quantitative data to say, does this actually work and make a difference for people who have had brain injury evoked changes in vision. I liked this one because as I was trying to explain to people what part is being blocked out with the occlusion, There are certain types of redundancies that our brain usually drops off and lets go of. And if signals and information between both eyes are not collaborating, they're not playing nice together, then there's going to be a conflict in that image in the center and cause confusion, and it causes more for your brain to process. And then if there's a disrupted pathway, you can see different changes. One of the studies mentioned that you can even track back one of the areas of brain injury by the type of damage, like in the left and right eye that you can see on the columns on the sides, where injury occurs in those. Number 5 is where I'm having the most problem. Even moving my eyes in that quadrant, it's very bizarre. I didn't connect it until my vestibular therapist had me try and look as if I were looking at a clock. And that whole section between, like that colored out section, is as if it's gone for me. And I didn't notice that until they had me physically look. Other things that I never mentioned to doctors early on were that I lost the ability to visualize. I thought on the list of symptoms, that's the bottom. Who would even care about that? But the optometrist said that's actually really important information. I went from being able to choreograph dances, being able to imagine them before they happened at the level of as if you remembered a movie scene, but it never happened, to not being able to picture anything else. And it's just blank. I was just mentioning before the show that my left and right side are completely mixed up now. So when someone says, raise your right hand, I lift my left hand. And when I say the other, trying to give directions in the car, even if I see it that says turn left, I'll verbally say turn right, even though I can see that. So there's something very off with that too. And they noticed, both the new neurologist and vision optometrist said that they noticed the magnocellular and parvocellular pathways were disrupted or not normal. And when your brain is used to efficiently working and something disrupts that path, then it goes to more inefficient pathways, which leads to not only the exhaustion, but necessity of greater blood flow. And if you don't have that blood flow, then you have problems.
Got it.
And then just different types of rehabilitation that exist. The visual midline shift syndrome, when you've had, just like I mentioned, the left-sided was all left-sided weakness, left side vestibulopathy, left greater, what's it called, blind spot. That when your brain perceives that something is not there anymore, it shifts everything over. And that to me was a huge piece of information because it felt like this paper was written about me after feeling like the symptoms seemed so bizarre for a year. And so if you know anyone who's struggling with this, I asked Dr. Cap if there's any way that we can get information out to people for the types of doctors who would know what to look for, because there are a lot of optometrists and neuro-ophthalmologists who don't use the same kind of tests and might miss this information. So she let me know about this, and this is an international search. So there are places, not just in the United States, if you know someone or need help, that they may be able to identify the right kind of test to help. And this is in my vision therapist next to her desk, and I asked if I could take a picture of it for this, because for the whole series of symptoms that I've had, we have not been able, or we hadn't been able to identify how interconnected all this was with vision, including speech therapy and vestibular therapy, and all of it tied back to vision. So the goal is to then work on vision first, get that reestablished better, then pair in vestibular and vision to get my brain to try and retrain with those. And then from there back into speech.
So you're only allowed one more slide. This is 2 hours. I don't want you to crash. So
how about you pick the last slide?
So this is, sorry, please. I'm just trying to give you a chance to. So this is dysfunction of the neurovascular unit. This is important.
Maybe just go to the last SPECT scans just to show what those look like, because it's almost there anyway.
This is neurovascular coupling.
So if anyone is interested in SPECT scans, this is a general look of healthy. These are just a couple different examples. You can see a TBI one. It looks like 2 little holes up at the top of the frontal lobes. And then just to see a comparison with mine, that it was, and you can go to the next, the one that was actually my slide. So it goes back to the beginning where you can see that there's definitely blood flow changes and that it explains all those same pathways that we're seeing in the others. So that's from Amen Clinics. And I thought that I wouldn't be able to get a spec scan unless I was in a research study. And I thought functional fMRI, there's no way I'm going to be able to get in that. And then once I found out that I was able to get it through here, it at least gave a lot of good information. That's all. That's way all.
So what an amazing story. I still cannot wrap my head around this, that you were injured. Even doctors will find it difficult to see what is next, what to pursue next, what to check for next, where to go next. And you being a citizen, not a doctor, you went through all of this while suffering this. And I'm sure while many people telling you that this is all just in your head, and you did this all the work. Thank you so much.
Thank you.
Thank you for doing this. And then thank you for sharing this. This is amazing work. I
I
wish.
feel like I was trained well at the University of Washington because I kept telling myself, I'm not a doctor, I can't do this. And then I thought, wait a minute, it's about asking questions and trying to find answers to what exists in connecting pieces. And that's what they train you to do as a researcher. So having the background in pre-med and pharmacology and neuroscience at least gave me a foundation of how to approach those types of things. So I was thankful for that. And also because it sounds strange to some people, but I've prayed that I would not miss pieces that are right in front of me. So even at times where I could not see, but I had the feeling I was like, oh, I need to connect, like save this article or save this Dr. Bean video. And then when I'm able to, I look at them, I go like, wait a minute, those pieces connect. So I'm not one person who says prayer magically makes things go away or your life is easy, but that you have purpose and that you can sometimes notice things that you wouldn't otherwise.
Absolutely. John Snyder says, when are you publishing this?
The date is set hopefully for the manuscript to be in by September. It's also, I'm thankful to the publishers for giving me flexibility, knowing that I am recovering and that I'm having to use a lot of AI tools. But I'm going to start getting more information out soon. That's what I'm hoping because I'm trying to get it out sooner.
Got it. So Michelle, with this, thank you so much. Tired, fighting, struggling. I am speechless. Thank you very much. And please thank your family as well, your friends as well, all those doctors who listened to you.
Yes,
Thank them
absolutely.
as well,
I
because
have.
at this time, they are a rarity. They're a
Yes.
rarity. There are fewer
I've told
doctors who
them to
listen.
not underestimate those words and for actually believing, because I said that is a life and death difference right there.
It
Yes, I'm
is.
going down. I'm going to crash.
So thank you very much. And hopefully we can have you more often to have
But
an update if you're okay with that.
yes,
And we'll. So Cool Beans, thank you very much for listening in. I know it's a long video, but please share it. Maybe it can help someone else as well. It can for sure help a lot of people. Thank you very much, and I'll see you tomorrow. Bye bye.